Asuncion, Batch 8 ng Ncma, Nurse Caregiver Management Alliance. Ang tatalakayin ko po ngayon ay ang 10 attitude or qualities of a caregiver or being a good caregiver. Number 1 po ay patient. Pinakauna sa lahat ng qualities na dapat meron ka, mahaba ang pasensya mo at hindi maubusan lalo na sa larangan ng trabaho mo as a caregiver. Number 2 is cherry demeanor. Dapat lagi kang good vibes or positive ang aura mo para may energy ka sa work at para na rin maging magaangang pakiramdam ng pasyente mo at ikaw din or as a banding. Pangatlo po is multitasking. Kakayahang gawin ng mga bagay-bagay ng sabay-sabay at hindi natataranta. Number 4 is being able to think quickly. Kakayahang makapag-isip ng mabilis. Alert sa bawat minuto at mabilis ka dapat mag-isip ng paraan para kung nangyari man ang hindi inaasahan sa iyong pasyente sa larangan ng iyong trabaho ay madali mo itong maagapan agad. Number 5 is punctuality. Lagi ka dapat nasa oras o tamang oras. Number 6 is willingness to learn. May pagkukusang matuto. Handa kang matuto ng mga bagay-bagay na makakatulong sa iyo sa larangan ng iyong trabaho as a caregiver. Number 7 is being a good listener. May kakayahang makinig. Marunong ka dapat makinig at maging active sa lahat ng oras. Number 8 is kindness and empathy. May kabutihan at malasakit. Marunong ka dapat magpakumbaba at umunawa sa sitwasyon ng isang pasyente o ng iba't iba ng iyong pasyente as a caregiver. Number 9 is willingness to give extra mile. May kakayahang ibigay ang lahat ng iyong makakaya at kakayanin at magpupursigido hanggang sa dulo ng iyong trabaho. At ang huli sa lahat is number 10, being able to take responsibility. Pagiging responsable sa lahat ng bagay. Lalo na sa gawain at sa caregiver, kailangan lagi ka din lahat sa lahat ng oras ay alert ka lahat. At para po magampanan ito, kailangan po ang 10 qualities or attitude as a good caregiver ay nasa atin pong lahat. Marami pong salamat. Ito po ang 10 attitude as a good caregiver. Salamat po sa inyong pakikinig at salamat po sa inyong panonood sa aking video. I will introduce myself to the patient. So, hi, I'm Liberty, Asuncion, your caregiver. How are you today? Good. Do you feel any pain? No. Okay, so I'm gonna introduce you what gonna be today is I'm gonna transfer you from bed to the wheelchair. Is that okay? Okay. Okay. So first, the first thing I'm gonna do is I double check the wheelchair. Lock it. Lock. And then I'm gonna proceed the next step. I'm gonna put my hand on her back, shoulder, and lift the knees, her knees, like this, and then on the count of 3, I'm gonna make her to sit. But first, can you put your hand on my shoulder? Then on the count of 3, you're gonna sit you. 1, 2, 3. Are you okay? Here. Are you comfortable sitting? Yes. And then next is I'm gonna put a belt on your waist to support you when we are gonna do you to stand. Transfer to the wheelchair. Okay. Is that okay? Yeah. Can you put your hand on my shoulder? But first, and then I will put my feet there. Far apart. And then, in the count of 3, we're gonna stand up. We're gonna lower I bend my knees like this. Okay, 1, 2, 3. Stand up. Are you okay? Then we just move like we are. That's it. So 1, 2, 3. Okay, so this is the procedure transferring your patient from bed to the wheelchair. everyone, my name is Liberty Asuncion, and now I'm gonna perform about bed batting. First, we're gonna prepare everything. Towels, one for the face, one for the body, and one for the private area, and one is the poop towel for cover the body. And we need gloves, no rinse or dry shampoo, water, and basins. And additionally, second person and be required for bed batting just in case you need for the patient. First, now, I'm gonna wear the gloves. So the patient now is undressed. First, I'm gonna do is to get the towel for her face. First, you're gonna do fold and do to clean the right face side. And then now I turn it because you cannot use the one you use to the right face. And then I turn my hand to left. And then you're gonna get another towel for the bed. Can I have your left hand please? And from the neck down to the arms. To the head. Flush it again. Can I have your right hand please? From neck again, get it to the neck, the arms, and to the back. Can you look up to the head? And that's it. Then next is the body. Armpit. Can I have your right hand? It's the body. Is the feet. Okay. Then cover it. Then brush. Then the next legs. Okay. Then the last part is the private part. So you're gonna wash and change the water, and then and bring the new fresh water for cleaning her or your patient private parts. So you have to do is this. Open your legs. Cover again. And last is shampoo the hair. Then put some dry shampoo to your hand and then put patient hair. That's good. Cut. And next is dry her from face, neck, arms, armpit, belly, legs, I will help the patient to dress up. So now the patient is now dressed up, so my patient is now ready to. Good afternoon everyone, my name is Liberty, the trainee of Ncma Batch 8. Now I'm demonstrate how to do the baby body. But first, we're gonna prepare first all the things for the baby body. All we need to do is basins for shampooing and cleaning the perineal area and for cleansing, body cleansing. And we're gonna do the thermometer, the temperature of the water and the body of the baby, shampoo, cotton buds, and cotton balls. And just in case the baby had a flu, we have a baby wipes to clean his mouth. And clothes for changing, towel, clean towel, blanket, and extra one just in case. And rubber mat, and a towel, and mostly the towel. And the hamper for the dirty clothes of the baby. First, we're gonna do is hand wash. We have to hand wash first before we start. Then, now I'm gonna get the baby to the crib and check it. So then I will put the baby here, take it out the blanket, and I'm gonna check if his diaper is soiled. So I'm gonna leave like this, then check. So the baby diaper is soiled, so we have to check it out. It's not really soiled, it's dry, so we're gonna put here, then we're gonna put back, and then I'm gonna clean the baby. Now I'm gonna take her off the diaper. And put it in the hamper. And then clean this area from top bottom to the hands. Through again, clean again, and to the bottom. And then now I will undress the baby. Just gently go downward, take out the booties, everything, and then cover her body first so that it will not cold. And then take the temperature of the water. So I will use my elbow to do the breaking. So this, it's okay, the 36.3, and also the water, it's just fine. And then I check the temperature of the baby, that's okay. His temperature is 37, just fine. Then ready for bath. So now I'm gonna do is gonna soak the cotton ball to the warm water. I'm gonna do his eyes. I'm gonna hold the baby like this. First for the left eye, then draw, then get another one. For the shampooing baby, then do like this, warm, gently, and just be careful for the we call bumbunan. I forgot in English, sorry. Yeah, this one. Like this. Then after that, bring the baby to the wings. Then right feet like this. Yeah, and now we're gonna bring the baby for the body cleansing. Let's put the baby, take it out the towel, but first take it out now the rubber mats. And just like this, hold the baby. Then rinse the body, and then do like this, and then put the baby here in the place, the changing table, and then try his body, her body, just gently. Then get the clothes. Get the diaper first. But make sure the baby is covered so that she or he will not get cold or chilled. Then clothes. Hold the baby like this. It. Here's the baby now, clean and fresh, and put her in her crib. Okay, and make sure he's comfortable, and then clean all your things that you use in baby bathroom, everything. Cloth and mostly don't forget to wash your hand and sanitize again your hand before you going out to your room for sanitation. That's all, and thank you. Hello everyone and good evening. My name is Liberty Asuncion, trainee of Ncma Batch 8. Now I'm gonna introduce to you or show to everyone the how to change the bed with client. First, I'm gonna tell you the things we need. First is sanitizer to sanitize the hand, and also the gloves. All the sheets we need. First is pillowcase, lower sheet, draw sheet, rubber sheet, and top sheet, and also the hamper is there. So now I'm gonna wash my hand first. The family, the patient is conscious or unconscious. So they said it's conscious. So we will continue now. So I'm gonna close the curtain and the door. Then first is unpack the lower sheet. Then I'm gonna position the patient. So I'm gonna put the right leg to her left side, and then her left hand on this cheek side and the right hand side. And then I'm gonna move the patient, roll it with the, and I'm gonna hold the dorsal and sacral part. 1, 2, 3. Now I'm gonna roll the lower sheet, draw sheet, and the rubber sheet. Then I'm gonna put the new sheet. Put the draw sheet and rubber sheet open left, right, and then put under. Fold it. Then now I'm gonna position the patient to the other side. I will roll it, hold it with the legs, and then 1, 2, 3, roll. Then I'm gonna do again, fold the left leg to the right leg, then put the hand to the right here, and then the hand on the cheek, the left. Then I will roll patient again and holding the sacral and dorsal part. 1, 2, 3. Then roll the soil bed sheet, take it out, and then put the soil sheet to the hamper. Then roll the new lower sheet, that's it. And also the draw sheet and the rubber sheet. Then position the patient again to the right position. 1, 2, 3. So just gonna change the top sheet now. Take on the old top sheet, put the hamper, the bed in, then 45-degree in, is change the pillow case. First, grab the pillow and carefully hold the head. Take out the pillow. Put the hamper pillow. Accidentally dropped the pillowcase, so I'm just gonna get another one. So hold the pillowcase up and hold the middle one and put the pillow inside. Put back the pillow. Hold the head. So make sure the patient is comfortable. So this is how to change the bed with occupied patient. Thank you. Good evening everyone, my name is Liberty Asuncion, trainee of Ncma Batch 8. Now I'm gonna show to you how to do the PEG feeding, percutaneous endoscopic gastrostomy. I'm assuming I washed my hand already, so I'm using gloves already. And then now we proceed to the feeding. Here is the things that we need: the food, water, and the crust and dilute of medicine, and the extra water, and assuming obsecto syringe. So first, you must elevate the head of the patient for 45 degrees, and then assess abdomen for dissection. So check if the head, assuming obsecto, check if have the residual. So it's no residual, so proceed. So first we're gonna put some water. Water for 20 ml. But don't finish the water and then put the yung na maubos ng pagkain na para hindi mapasukan ng hangin, o kaya pwedeng takpan para maiwasan ng pagduga ng pagkain sa pagduga ng pasyente. Then put another water. Assuming that the food is finished, and then you put the medicine, mix the medicine. And when everything is finished already, put the water, flush out all the food. And then cover it. Good evening everyone, my name is Liberty Asuncion, trainee of Ncma batch 8. Now I'm gonna introduce to everyone the NGT tube medication. The thing we need is sanitizer, gloves, medicine crusher, water, 2 medicine, swimming medicine, litmus paper, syringe, and extra water just in case. Now I'm gonna introduce myself to the patient, and I'm gonna tell to my patient what will I'm gonna do to her. Hello, good evening. My name is Liberty, your nurse today. So, by the way, what is your name?
Trainee.
Lenny. So, you know your birthday? Do you remember it?
Yes.
So, when is it?
August 1, 1990.
Okay, good. So now, I'm gonna do to you is I'm gonna give you medication through your NGT. Is that okay?
Yes.
Okay. So now I'm gonna put the gloves now. Gloves now. So I'm now gonna do the medication. So I will check the placement of the tube. So there are 3 ways of checking the NGT tube. So that when that one is obtained X-ray, measuring the tube and checking the stick contains 5 ml to 10 ml. So aspirate the gastric contents and check the pH level. I will check. And then I will put the plastic enclosing the litmus paper. So I do this. So litmus paper have 2 colors, pink and blue. So this is pink, so this is okay. So now I will proceed to the medication. So I will press the medication, the medicine. Then I put in the 1 bottle. And then the other medication, I will put here in the other bottle. Then I'm going to put water. And then before that, to give the medication, you have to elevate the head of the patient for 30 to 45 degrees. Elevate. So now I'm gonna put the syringe and then put the water, flush the water for 30 ml. Flush it, and then now I'm gonna put the medicine. Flush the water again. Flush water. Then another medicine. Flush the water again. Flush the NGT tube and medication, and now it's all finished. So we take it out. And then medication is given, so I will close now the tube. So this is finished. So all finish your medication and they are already done. Good evening, everyone. I'm gonna show to you how to do the vital signs. It's already in my hand, so I wear already the gloves. So all the things needed is thermometer, watch, wipes for sanitize, oximeter, stethoscope with pressure cuff, and pen and notebook for documentation. Today is I'm gonna be you the vital signs and make sure everything. And how are you today?
I'm good.
What is your name?
Denny.
And then my name is Levi. You're you're a nurse today. And then, do you feel okay? Do you feel any pain?
No, there's no pain.
That's good. So now we're gonna do and proceed our education, vital signs today. Okay. So first, I'm gonna check your temperature. So 36.3, your temperature. So I'm gonna do 36.3 and oximeter. So we're gonna check. I'm gonna check your oxygen using the oximeter, and then using for this is you're gonna put the point finger and here it is. So we just wait. Oximeters. $97 to $94. Over $94. Yeah. Okay, just fine. And then I'm gonna do your pulse. I'm gonna find your pulse rate. Pulse rate. So I'm gonna put your hand here. Are you relaxed? So I'm gonna find it. I'm gonna use it. So you're gonna wait this for 30 seconds. Pulse rate is 26, so times 2 is 52. So I'm gonna document here, pulse rate 52. So now I'm gonna do your respiration. And I place my other hand to your back. Then take a deep breath. One more time. It's okay. So your respiration rate is just normal. So we're gonna normal. So now I'm gonna do for you is the blood pressure. So the next is I'm gonna do your blood pressure. So I'm gonna put this one. Make sure the arms is on the heart level and legs is uncrossed. Place the stethoscope on the glacial force. Turn the knob. Wait. Place the stethoscope in the brachial artery. Turn the knob clockwise, close to the pump air, creating the pump until the reaches to 170. Slowly release. So your force rate is 120 over 80. Okay, so it's normal. So the first pumping sounds is the systolic pressure, and the last pumping is diastolic one. So this is all the vital signs. That's all. Thank you. Perform how to clean the feeding bottle and sterilize the feeding bottle, and the other one is how to proper birth the baby. But first I'm gonna do is how to clean the feeding bottle. Assuming this is the feeding bottle, and then and this is the baby soap feeding bottle. So I first prepare the things, basins. So you need the tongue for the sterilizing and the sterilizing pot. So first now is wash the bottle, take out everything. Take out the tips, everything the tips, take out and brush it. Give it a brush. And the tips with a small brush. If you don't have the brush for the tip, if you have to, you can use the small finger to clean up. Wash it properly. Take out the leftover of the milk inside the bottle, feeding bottle, and also to the tip. Wash it again to take out more of the salt and then after this we just put this up first, and then now prepare the sterilizing pot and put for half of the water in the pot, not full. And put the bottle inside. Also the cover, and last the ticks. Ticks put inside, but not in the same time. And then put in the stove and sterilize it for 15 to 20 minutes, maximum to 25 minutes, but 5 minutes only for the teeth because the teeth is really soft. Then you cover it and then wait for 15 minutes to 20 minutes to boil. Then clean up all the things that used in cleaning the feeding bottle and sterilize it. So assuming that 15 to 20 minutes already, so turn off the stove and make sure you use the pot holder so that you will not burn yourself, and slowly lift up the cover like this, not in the face on you, just like that. put the cover in the one. And put the tray, assuming tray, and then use the tongue to get the feeding bottle that has been boiled. One by one. So be careful because it's hot. So try not to burn yourself. And the teeth also, it's right there. So we put already the teeth there, and then make it cool first. This is how to clean the feeding bottle. Now I'm gonna do the formula of the baby, formula milk, so how to do it. So first is do the bottle, prepare the bottle. So this is the milk, assuming milk. So, and the water I'm gonna use is warm, not boiled, it's just warm water. So I'm gonna do her milk about 6 ml, and also the measurement of the milk is 1:1. So when you're doing the milk, formula milk, it depends how months is the baby, or how the doctor said, or the mother or the parents. So first, pour the water, about 6 ml. Then now 6 scoops of milk. 1, 2, 3, 4, 5, 6. Then close it with the teeth and the cover. Don't shake the milk, just only the teeth, and hold just with the teeth and cover it. So shake it like this, slowly, so that the milk will be mixed properly, like that. Okay, cannot be like this, just only slowly like this. Yeah, and then when already the milk is mixed properly, you get the lid and get the baby ready for the milk. So I'm just gonna put the milk bottle there. I'm gonna get the baby and I'm gonna feed her. So you have to carry the baby like this slant, a bit higher the head. Okay, and then put the baby like this, and then but first is check the temperature of the milk, if that is hot, or just fine. Just do like this first, if you can do like this. So this is the proper way of test the milk. So when it's okay already, so give you can do sit, then give the baby the milk. Slant, then you can give the milk half, and then make her birth. Just stop like this, and then put the baby on shoulder like this, up, and then a bit top on the back, slowly. And then when you heard that she birthed already, just do like that, good. And then continue, give her the milk. So like this. Don't make like that level, just lay down, just do like this again, the slant, higher the head, and give the milk, the left milk again to finish her milk. So This is the proper way of giving the milk and burping the baby. And then when she finishes again, try to burp him again like this. And when